Okay, and with that, I'm going to go ahead and get started. Right, so welcome everyone. My name is Miranda Berger. I'm the Deputy Director with Olympic Community of Health, and I'm so excited as we embark on 1 year of Olympic Connect. Back on October 1st, we celebrated, and to embark on this new year with each of you. This is truly innovative work that we're doing together, and systems change can be really hard. And as we know from working with clients and patients, it's also really needed. So this work continues to excite me for what's possible and to forge something better for our communities. All of us at OCH are committed to making this work, this being Olympic Connect work, for the long term. And you'll see in the scope of work and funding model that sustaining this work is top of mind for us. Um, so I'd like you to please take a moment to introduce yourself to the group using the chat instead of coming off mute because we're such a large group. If you could find the chat and take a moment to pop in the chat your name, the name of your organization, and your role. So we should start to see lots of chats start to flood in. Welcome, Molly, Cassidy. Hi, Billy. Hey, Don. Welcome, 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 Christine. Hi, Faith.
Hmm.
Welcome, Carlos and Macy. Welcome, Chief Black. Hey, Rachel. Hey, Alicia. Hi, PCHS crew. They're the ones all together at the table. Hi, Nika. Welcome, Desiree and Kimberly. Hey, Rook. Hi, Patrick. Thanks for joining today, everyone. All right. A few housekeeping items. Again, we're recording this meeting so you can rewatch it and share with your teammates who weren't able to join today. If you didn't already, please take a moment to rename yourself so it's easy to understand who's speaking. I'll be sharing my screen, like I said, and using chat and a shared document. So if you have access to them, double screens will probably be very helpful. As much as possible, we'd like you to keep your camera on. That helps me as I facilitate this meeting, kind of read your body language a little bit more. It's more challenging in a Zoom space than when we're in person, so the cameras help. We're a big group, so please keep yourself muted when you're not speaking. I'll invite you to be as present as possible today. It is a 90-minute meeting. I know that's a long time to turn off your email or notifications or distractions, but invite you to do that if you can. And if at any point you do need to step away, please pop a quick note in the chat so that we know that you're not here with us in that moment. We're going to be using a shared document. I'll paste the link to that in the chat, and I sent it out to you all via email. And we'll use this to capture your questions. This will help us track your questions and ensure we either get them answered today or in our follow-up. And it also helps us better understand what's on your mind and where we need to do a little more collaborative thinking. See, a few more folks joined us, so I'm going to let them in. And the link to the shared document is in the chat. All right. So today is our 2026 Care Coordination Partner. That's you all, contracting orientation. So today we're going to create shared understanding of what to expect as we continue this work together next year. We'll do an overview of the 2026 scope of work and the funding model, and that'll include grounding us in what this work is all about, reviewing OCH's responsibilities, reviewing your responsibilities as a care coordination partner, reviewing key expectations, including performance measures and goals we're uplifting next year, and reviewing the funding model and how payments are calculated. It's a lot to cover, even in our 90 minutes today, so I wanted to share right here at the outset that today is just step one. We'll be regularly bringing you all together throughout 2026 as we heard a desire for this throughout the year. And we'll also touch base on how this scope of work and funding model is going early next year. And we expect that we're going to have lessons learned as we embark on these changes together. OCH is committed to continuing to support you all and to your successful implementation. So we can adapt and make changes if something isn't working throughout next year. It's a robust agenda for this 90 minutes, so I'm going to keep us moving along. We're going to have 2 opportunities for group discussion, so please use the shared document for your questions and comments as we go. All right. Our network of care coordination partners is consistent from 2025 to 2026, so we're all excited that you've chosen to continue partnering with us in this work for another year. Each of you brings a unique lens and expertise, and there's so much value in this diverse group of partners. You're part of a growing movement, and this group are those that jumped in with us at the ground floor last year, so you're pioneers. We have plans to bring more partners into the network in 2026, both resource and service providers and additional care coordination partners. And we'll have more information about what that will look like in the early spring. So I'll invite you to find the chat one more time, and using the chat, please share one thing you're excited about for 2026 as it relates to Olympic Connect. Helping clients reach their goals. Thanks for going first, Christina. New additional partners. Yes, Erica, me too. More community partnerships now that people are familiar with Olympic Connect. Yes, Roz. Connecting to more young clients in the area. I agree. I see a lot of opportunity for that, Kelly. Connecting clients to more resources. Yes, Haiti. Increasing our capacity. Yes. Agree, Chief. Additional resources and partners. Agreed, Dominica. Getting more known staff involved in Olympic Connect. I am excited to hear you say that, Christine. Us too. Growth all around. Yes, Kelsey. Wonderful. Well, please keep sharing in the chat for everyone to observe and hear. It's exciting to hear what you're excited about. A little bit about Olympic Connect. I'm not going to talk about this too much, but just to ground us, Olympic Connect is a community care hub of Washington, one of 9 in Washington state. We're a community-driven network of partners throughout Clallam, Jefferson, and Kitsap counties, and we support care coordination to local resources, things like childcare, food, employment, healthcare, and much, much more, to help everyone get the care and support that they need to thrive. Olympic Connect connects people to care and services through trained and highly skilled trusted helpers. Many of you are in the room today, and trusted helpers who live, work, and play in our region. Trusted helpers are the ones who provide clients with the one-on-one support they need to achieve their health and other life goals. Olympic Connect priority populations include individuals on Medicaid insurance and those that meet the definition of prime age employment, which is defined as those between the ages of 25 and 54 and who are un or underemployed. And due to changes in our funder requirements, you're going to start to see these priority populations more heavily emphasized next year. Olympic Connect strengthens the regional network of partners and coordinates between healthcare and social service providers, addressing health issues no single sector or tribe can tackle alone. We help connect regional resources, track health outcomes, and remove barriers to create a region of healthy people, thriving communities. So, when we look at the 2026 scope of work, we're going to break this meeting into 2 parts. First, we'll look at the scope of work, and second, we'll look at the funding model. So just looking at the scope of work, what's different at a high level? The scope of work is largely the same as 2025, and any changes to the scope of work are to address our lessons learned from 2025, to follow national trends for sustainable practices of community care hubs, and to better define the work that's being done. Your day-to-day as a trusted helper should look largely the same, and the new scope of work and funding model allows flexibility for each organization to determine what, if any, changes they want to make for successful implementation. A few things that are different about the scope of work that I want to highlight is there's no more complex versus full service scope of work. And I'll talk a little bit more about what's different with this in particular when we get to the funding model. There's also no more prescriptive FTE. And I'll go into this more in depth when we talk about the funding model. Through this funding, OCH supports a network of care coordination partners providing community-based care coordination services, coaching and health education, and resource navigation and referrals to meet identified needs of Olympic Connect clients. Care coordination partners are you all in the room today, the 12 organizations that we contracted with at the outset. Your organizations contract with OCH to proactively identify and connect with community members who may benefit from Olympic Connect services, receive referrals, and provide community-based care coordination services to enrolled clients. We started this journey together back in November of 2024, and our first contracts end at the end of this year. Each of your organizations has indicated your desire to continue partnering on this work next year. Most of our contracts for 2026 are fully executed to continue next year. The new contracts begin on January 1st and end on December 31st. And if you have questions about the status of your contract, you can connect with your organization's leadership. So I mentioned community-based care coordination, which is a person-centered approach to care that moves clients through a continuum of engagement, assessment, support, and connection. Olympic Connect deploys an approach to care that's strengths-based, trauma-informed, and culturally appropriate. Care coordination partners, again, that's you all, employ the trusted helpers, providing direct services to clients, and we referred to this workforce as community-based workers, or CBWs. CBWs have knowledge, expertise, and/or lived experience living within and/or navigating the local communities they serve. Community-based care coordination services are expected to be provided both in person and via telephone or virtual meetings, and it's up to your organization to determine the best modality to deploy those services. So next, we're going to talk about responsibilities of you, the care coordination partners, and there's 3 slides that I'll go over. The first being at an organization level. So the organization is responsible for recruiting, hiring, retaining, and developing those CBWs and their direct supervisor to support successful implementation of the scope of work in alignment with the funding model. OCH encourages salaries and benefits that align with the definition of living wage job, which aligns with our prime age employment focus. The organization is also responsible for supporting the professional development for CBWs and their supervisor, providing quality assurance to ensure quality services and accurate data are provided to OCH and to Olympic Connect clients, integrating Olympic Connect with internal systems, notifying OCH within 48 business hours of key staffing changes or delays that might impact service delivery, providing representation at our regional advisory group and other OCH-led learning and convenings as appropriate, and ensuring achievement towards the minimum standards for contract compliance, and I'll review those at the end of our agenda. Next, responsibilities of the direct supervisor include supportive supervision for the CBWs, including case guidance, caseload management, compassion fatigue prevention, and professional development. We encourage supervision that is trauma-informed, strengths-based, and culturally appropriate. Supervisors are responsible for reviewing and assigning new referrals to the CBWs, ensuring fidelity to Olympic Connect policies and procedures, providing technical assistance to their team of CBWs, quality assurance to ensure quality services and accurate data are provided, providing solutions-oriented feedback to OCH to support our continuous quality improvement of Olympic Connect, and again, notifying OCH within 48 business hours of any key staffing changes or delays. And last, for the CBW. Again, this is the trusted helper working with the Olympic Connect clients. Their responsibilities include quality community-based care coordination services for all clients, including determining eligibility for programs and services, maintaining a knowledge of local partners, resources, and services to support connections to care, proactively identifying and enrolling Olympic Connect clients, maintaining fidelity to our policies and procedures, adding to and maintaining our regional resource directory, and again, providing solutions-oriented feedback to OCH. Next, I'll talk about responsibilities of OCH. Olympic Connect is a service of OCH, and we consider ourselves stewards of this program, not owners. We fulfill our duties and provide support in alignment with the 5 elements of a community care hub, and these 5 elements are based on national models. Under community voice and engagement, we implement a regional communications plan, including designing and developing marketing materials, maintaining our website, translating key forms and materials, organizing our regional advisory group, and providing feedback mechanisms to inform improvements. We also conduct storytelling, which is represented through our Voices of Olympic Connect campaign that's been shared with you all. In sustainability and business operations, we provide timely payment to you, our partners. We provide data transparency and reports for payments, and we seek additional funding to support sustainability. In care coordination operations and reporting, we maintain a policy manual, set procedures and workflows. We offer referral management, including providing an online referral form, case assignment, and eligibility checks, and provide continuous quality improvement, as well as providing and stewarding our regional resource directory and the other technology like Connect2 Coordinator. In network management and capacity building, we provide contract monitoring and oversight, technical assistance, and we recruit additional network partners to work towards our goal of a social care network. And under community-based workforce, we provide orientation and onboarding, technical assistance and training opportunities. We organize and host convenings, learnings, and networking opportunities, and we steward the learning management system, which is the login through Genius or Blackboard, depending on which version you've become accustomed to. So I'd like us to pause here for some reflection and for you all to hear from one another. So if you haven't already, please open up the shared document that I posted in the chat, and I'll post again. So using this shared document is helping us manage this really large Zoom room. And again, this is also going to help us track what's coming up for the group and to make sure we get all of your questions answered. I want to say right here, we may not be able to answer all of your questions in this 90 minutes, but using the document will ensure that we tackle your question in the follow-up if it's not addressed today. And we'll likely create an FAQ that we can share out in our follow-up as well. So I'd like you to take 1 minute by yourself while I organize our virtual breakout rooms, and then I'm going to put you into groups of 4 in breakout rooms. At the outset, I'd like to say we haven't yet talked about metrics, payments, anything with the funding model. We're going to do that next. So please keep your reflections and questions to the scope of work we just covered. So I'd like you to reflect on the following. 1 thing about the scope that gets you excited, and 1 thing you're worried about or that you still don't understand. So you'll open the shared document. You're going to find the second table labeled Activity 1, Scope of Work. You'll find your organization. Each organization has a row, and you'll put your reflections in the table. So 1 minute here while I organize our breakout rooms, and then I'll send you into groups of 4. Okay, you'll go into a breakout room. Some of you have a group of five. You'll be here for 5 minutes. So use the document to type your reflections. You may or may not be with others from your organization. And then we'll come back as a large room to see what rose to the top. So see you all in about 5 minutes. Okay. And AJ, Miranda, Christine, are you having a hard time finding your breakout room? I can force move you if you would like me to, but I didn't want to do that without you telling me. I see Miranda found it. I see AJ found it. Okay. Christine, looks like Christine found it, and this is an extra Christine. She might be on phone and on something else. See a couple themes coming up. folks are going to start coming back.
Can you hear me?
Yes, we can.
Okay, so when I was in my breakout room, I could not hear anyone and they can't hear me. And I don't know what's going on. So sorry. I thought if I left and came back, it might change that.
Okay. Yeah, we can hear you just fine, Rebecca. Sorry about that.
Okay. No, okay.
All right, folks are coming back in from the breakout space. Welcome back. Welcome back. You might have accidentally unmuted. So if you're unmuted, if you could make sure you're back on mute, that will help us keep the large Zoom room organized. And what I'm going to do is I'm going to invite you to keep that document open. I believe you should be seeing it on my screen here. And I'm going to take this partner by partner and invite you to kind of chime in on something that you're worried about first. So I'm going to start with Boys and Girls Clubs. Rachel, I saw you. I'm not sure if anyone else from your organization was able to join this morning, but do you want to come off mute and share anything additional context-wise about something you're worried about or that you don't understand?
Sure. Yeah, Mary had a conflict this morning. I guess I think, and I don't know, one of my worries, the first one I put there is now the focus on the priority population. Whereas one of the things I thought made Olympic Connect stand out was that it was available for everybody. And so I'm worried with that shift in focus, unless somebody's in that prime age group wanting an employment change, that we're not going to be supporting everybody like we started with.
Thanks for clarifying, Rachel. And I want to offer something back to you, which is, um, things may change, but we feel very committed to continuing that Olympic Connect will serve anyone. So by sharing that those are our priority populations, that doesn't mean we won't serve other people who might not fit into those populations, but that's where you're going to see a little more emphasis in the new year of reaching those populations in particular, while maintaining that we can serve anyone. So
Great,
thanks
thank
for
you.
sharing. East Jefferson crew, I know there's a couple of you, so you can either chime in or nominate a spokesperson to talk about something you're worried about or don't understand.
I think I just got nominated. If you hear backup beeper, that's the bus driving over me. But I think two things, just to comment on the Rachel's observation. I think we share that same question regarding the age, specifically because Jefferson County's demographics is not conducive to the preferred age group that you mentioned. I can't remember the term you used, but I think 90% of our clients out of 1,500 last year were over 65, and that reflects the population. So there's not really anything we can do about that. Um, so I'm hoping that there isn't. I don't remember that specifically being called out as a scoring metric in the contract, but I'd have to go reread it if it
We'll
is.
we'll get there next, Chief, but thank you
Okay.
for sharing a little bit more about
Um,
that. And again, yeah, the priority doesn't mean we won't serve others
okay.
and that it's both. They don't have to be there
Right.
is some overlap, but also folks on Medicaid.
Yeah. And then getting back to the assignment, though, my two areas, ones I'm excited about and one I'm concerned about, are the same. I'm excited about the access to partnerships because I think I'm still a real strong supporter of the system, the network, the platform that connects everybody behind the great Oz curtain. But at the same time, I'm hearing and concerned about the partnerships because there's so few resources here
Hmm.
that it's thin and like I think I heard somebody else say that or that the housing got pulled element got pulled out of one of the descriptions. I think is one of the things I heard. We don't have enough housing, and that is one of the primary needs that we're hearing. Um, Even for seniors, their taxes are going up, their HOAs are going up, their Social Security is not, and housing security is a big problem here in Jefferson County. So the lack of partnerships, I guess. Sorry to ramble.
Thanks, Chief. And I see that echoed through quite a couple of folks' comments in this shared document about just not having enough resources available to meet the needs in the communities. And I know that's something top of mind for OCH as well, and something that we're looking at the data at to better understand where we might be able to make some other investments to support some of that. And we know housing is going to remain a challenge. So thanks for sharing. First step, anything to add that hasn't been shared already? And if you're shaking your head, I can't see you. So
This is Alicia. So I actually wasn't the one to write scope creep in the sheet, but that has been something on my mind of like, how do we navigate that? Where like our agency area is specific to kind of a particular population, and that's how our contract is with OCH to do this work. But then also as the work grows, how do we make sure that we grow with the work and also maintain the real good quality focus on our scope and what we do well. And I think that's something that we just need to be intentional about. But I thought it was kind of cool that something that's been, tickling in the back of my mind from my level, but then clearly my team is also thinking that. So I don't know if that's coming up for other agencies as well.
thanks, Alicia. I also see that shared in a couple of places here on the document. And you're speaking to another purpose of this. OCH is going to use this document, but we're going to share it back with you in hopes that this helps your teams kind of understand what's on each other's minds and maybe serves as a jumping off point for more conversations internally as well. Jefferson Healthcare, you echoed a lot of the resource comments and questions. Anything you feel is important to add to the conversation?
I feel like a lot of the stuff that's already been talked about is the primary concern of, just the lack of resources or a single resource for financial help, and housing. So same.
Thanks, Dawn. Okay. Known crew, anything that feels important to add or uplift?
Hey Miranda, it's Carlos from
Thanks, Carlos.
Known. I think something that came up in our breakout room was just staff expectations and client expectations of because of the lack of resources or any other situation not being able to meet everyone's needs. We called out many of our clients have complex behavioral health issues, and a lot of people maybe feel inadequate to serve that type of population. And
Thanks, Carlos. Appreciate that. Yeah, I agree. Something to continue talking about. And we've heard some feedback about ways OCH might be able to support some improved marketing on setting some better expectations at the outset of what Olympic Connect can offer. So this is something top of mind for us going into the new year of improving some of the marketing to better address those concerns that we've heard coming up. Okay, Oli Pen Y, folks. We've got 2 Ys, so Oli Pen Y team. Anything to add that hasn't already been said?
I think our team has been discussing, it's very much along the lines of what everyone else is saying, housing seniors, and also just getting better integration between the resources and partners that already exist and the people that are already on the ground doing the work, especially in Clallam. I know Jefferson is having some issues with that as well.
Thanks, Corey. Agreed.
Miranda, I just want to let you know that you skipped Lutheran.
Oh, thank you. I didn't realize that. I'm sorry. Lutheran, you just didn't have a lot of things you're worried about. Just kidding. Lutheran team, anything you feel like is important to add?
No, I think, thank you, Yvonne, but no, I think we are all in agreement.
Thanks, Levon. Okay. Owl 360, anything that feels burning or important to add to the conversation?
I think one of the things, and we talked about this in our group for Owl 360, just per contract, we kind of have this expectation to almost double our caseload, but we're like Chief Black working with a very specific age demographic. And we've really tried to expand that to make sure that we're supporting as many community folks as necessary. So I think that that is challenging and concerning. And of course, Al 360 provides a ton of resources, but we're always often maxed out. So that balance between being able to support all the people that are coming in, or where do we refer them? So resources echoed throughout this conversation.
Thanks for sharing, Kelly. PCHS crew, anything to add?
We echo what's been said. I think our colleagues have summed it up well. We're on the same page.
Great, thanks PCHS. Quilcene crew, Kimberly, I see you're on the call and a couple others. Anything to add that hasn't already been said?
I do not have anything to add that hasn't already been said. How about you, Debbie? Are we good?
Yeah, I'm good.
I'm good. Oh, sorry, Billy.
Thanks, Quilcene team. We're going to go backwards next time, so you won't be last in our next activity. And last but certainly not least, Vulpin, Nika, or Patrick, anything you feel like is important to add?
Nothing to add, and I definitely agree with what everybody has said.
Thanks, Nika.
Okay. Miranda, you skipped Kitsap YMCA. I'm sorry.
Other YMCA. Pearson Kitsap YMCA. Anything to add? Thanks, Yvonne, for keep managing me.
Agree with limited resources and working with clients, but also we would love to have a better, sorry, my dog is dreaming, would love to have a better understanding of how OCH specifically defines care coordination versus case management, because we would love a little more guidance for our team.
Okay, thanks, Maddie. And I see some nods going along with that, so that's helpful to hear. Okay. And I love that you shared something that you're excited about. I don't want to skip over that. I do need to nudge us along to the next part of our agenda because I see some of your questions are related to the funding model. So I want to make sure we do that justice. So I'm just going to call out a couple things in the excited column that I saw. Helping people get their needs, having more access to partners and partnerships, getting connected with one another, having some more flexibility, helping our clients achieve their goals, fine-tuning how we can work together, furthering developing our programs, understanding the overall work better and how to use our tools more effectively. Again, more flexibility in the funding model, just continuing the work together next year and finding some more stability in Olympic Connect are just a couple of the ones. And I see there's a much more exhaustive list. So none of that is lost. And thank you for sharing. Okay. So next we're going to talk about the funding model. The new model continues to provide robust funding for each of the partners, you all, that we've been working with in 2025, and there are 12 of you in total today. Instead of a cost reimbursement model, which is what we had in 2025, wherein your organization incurs costs that you then invoice to OCH and get reimbursed for. This new funding model breaks the funding into 3 different categories, and I'm going to talk about these each in much more depth. So I'm going to ask you to just hold on your questions until I get all the way through the slides, because I've seen what's been coming through in advance, and I've done my best to address most of them. So the slides will build on each other, I promise. So the 3 categories of funding are infrastructure dollars. These are a set amount paid twice next year, 50% in January and 50% at the mid-year point. The amount is set based on an estimate of the number of cases your organization will manage next year, and that closely mirrors 2025 and does nudge many of you to increase your caseloads. The second category is case management dollars, which are paid based on the volume of cases and work performed on each case, and these dollars are paid to your organization every other month. There's no ceiling and no floor for these dollars. So this element is based on whether your organization provides more clinical-based or community-based services, and I'll talk more about that in a minute. And the third category are performance incentive dollars for progress towards 5 metrics, and those dollars will be paid quarterly. 4 of those 5 metrics are based on your organization's performance, and 1 is based on a county-wide metric to encourage collaboration. I want to talk a little bit about why you're seeing these changes. First, to reduce administrative burden, both for you, the organization, and for OCH. So you're no longer going to submit monthly invoices or backup documentation, which should be a great time saver for everybody. Second, to provide you, the partner, with more flexibility. This model does not require a set level of FTE and allows you to do the work with the staffing model that makes the most sense for your organization. We also want to align better with the other 8 community care hubs in Washington. All 9 hubs collaborate and are moving to a model that emphasizes case management over infrastructure and provides performance incentives. I also think it's important to share with you all that our current costs for this work are not sustainable. So 2025 was our first year, and we all needed time and resources to build up our capacities and establish our systems. However, our current costs are about $5,000 per person served by the hub, which is just not sustainable. The national average is $900 to $2,000 per person, depending on the level of complexity. Obviously, more complexity meaning more money. And we really want this work to succeed for the long term, so this is our first step toward that sustainability. It's also time for us to serve more people. In 2026 and beyond, we will focus on growing the volume of the hub to make a meaningful difference across the population and to be able to demonstrate our value to other potential funders. So our ambitious goal for 2026 is to serve 3,000 people in the region. And this model aims to incent a combination of volume and quality. And last, documentation has been lagging. Many of the key elements in C2C aren't being documented, leading to difficulties in reporting to our funders and lower data quality than we need to prove the concept of this work. So this new model also places an emphasis on full quality documentation so we can better tell the region's story. Okay, so the new funding model, your organization will be classified in 2 different ways. You'll either be classified as either community-based or clinical-based, and this is based on the setting of the services provided. So North Olympic Healthcare Network is clinical-based, First Step Family Support Center is community-based. When I sent you the email with the shared document, I also sent you your organization's specific scope of work and funding model with the highlighted section, so you should be able to reference that document to see whether or not your organization is community or clinical. The second way your organization is classified is based on caseload expectation or size. This is based on partner interest and capacity, and we're classifying partners as either small, medium, or large. And this is based on the minimum point in time expected caseload. And again, the purpose of this is to really nudge us to increase volume. So small partners will serve about 40 cases at any given time. Medium will serve 60 and large 120. Again, your organization has flexibility to determine what staffing is required to meet that caseload expectation, and you can exceed the minimum caseload expectation. That information will be used to inform our 2027 contracting purposes. And again, there's no more complex versus full service and no more FTE. There are 3 ways that your organization can earn payments in 2026, and I'm going to go into each of these in depth next. So there are infrastructure payments, which are set amounts to support the administrative and infrastructure costs. There are case management payments, which are variable amounts based on the volume of cases and work performed on each. And there are performance incentives to incentivize and recognize high performance. So first, infrastructure payments. So again, there is no invoicing or documentation required for use of these funds. It's a flat rate based on caseload expectation size. So whether or not your organization is small, medium, or large informs the amount of infrastructure dollars your organization will receive. The caseload expectation is an average, and we understand that caseloads fluctuate throughout the year. So I've heard some anxiety about ability to maintain a caseload size all the time. Sometimes it might be more, and sometimes it might be a little less. So this is the average we're looking for throughout the year. Caseloads are captured by open cases at any given time. Cases are assigned to your organization based on assignment criteria that you provide to OCH. So this is based on the geography that you serve, any populations of emphasis or limitations on individuals you serve, and working with your supervisors to maintain the best practice caseload size of about 50 cases per 1.0 FTE. So if you are a full-time employee fully working on Olympic Connect, you could expect to have about a caseload size of 50 at any given time. And again, this is based on national models. It's the supervisor's role to manage individual caseloads, and OCH does our best to make assignments within your organization's desired caseload size. So we do look at the overall size, small, medium, or large, and try to make assignments based on that. Infrastructure payments come in 2 payments next year. The first will come in January upon contract execution. That's half of the funding amount available. And the second payment will come at the mid-year point, July, upon meeting minimum standards for contract compliance. So if you are a small-sized partner, you will receive $16,000 in January and another $16,000 in July. This funding is intended to cover administrative and infrastructure costs, things like purchasing new equipment, supplies, professional development costs, administrative time, those kinds of pieces. And again, there's no invoicing or documentation. You receive the dollars and you can use them as your organization sees fit. The second type of payment that will come is case management payments. Again, no invoicing or documentation required. These are paid every other month, and the first payment will come in March for January and February, and I'll talk more about the timeline later. This is based on the volume of cases and work performed on each case, and work performed is measured by the stage of community-based care coordination completed. The stages are engagement, assessment, support and connection, and discharge, and all of the data for these payments is pulled directly from Connect2 Coordinator. So this table outlines the payment amounts per stage. So there are different rates based on whether you are community-based or clinical-based, and again, this follows national models and is intended to move us along towards sustainable costs. You do not have to complete the full care continuum to receive payment. So for example, you might do only engagement and then discharge somebody. And in that case, if you're community, you would receive $225 for engagement, $300 for discharge, and you would not earn the assessment and support and connection pieces. Each stage is paid only once. So for example, you might do more than one assessment, or you might make multiple referrals, but this is only paid one time per case for a maximum earning of either $1,000 per case or $1,300 per case, depending on the model. Again, data is pulled for all cases, both open cases and closed cases, for the reporting period, and cases do not have to be discharged to receive payment for the first 3 stages: engagement, assessment, support, and connection. Okay, I'm going to go into each stage specifically, and I've pulled in screenshots from Connect2 Coordinator so you can see where the data is pulled from. So engagement is captured by enrollment, which is based on this task: outreach, program introduction, and consent for services. And this is paid when this task is marked contacted, enrolled, in program. So the C2C data is pulled, the number of cases with this outcome are counted, and that equals the engagement dollars provided to your organization. This is not paid for work done with clients that do not end up enrolling in Olympic Connect. That's considered outreach, and that's part of what infrastructure dollars are intended to support. Next, assessment. Assessment is captured by completing the social and health needs assessment, which is based on this task. Update social and health needs assessment. So when this task is marked either start assessment or skip assessment on file, assuming there is in fact an assessment on file, that will trigger the payment for assessment. So the C2C data is pulled for the reporting period. The number of cases with this outcome are counted, and that equals the assessment dollars provided to your organization. You will not be paid for cases that do not have an assessment. So for example, if a case is lost to contact and closed before you complete the assessment, no assessment dollars are earned. Some of you have asked us questions about when it's appropriate to update an assessment versus start a new one. So here are some guidelines. A new assessment should be documented for each new case. For cases that OCH opens and assigns to you, we typically start an assessment based on the referral form, and it's appropriate to update this assessment instead of creating a new one, and that won't impact your payment. If it's been more than 6 months and clients are expressing new or different needs, or if you are opening a case on your own, you will need to complete a new assessment instead of updating the old one, or in the case of creating your own, in the instance of creating your own cases in Connect2 Coordinator, you will not see an assessment already on file from the intake form. Next is support and connection. This is captured by supporting the client in finding resources and making referrals to appropriate services, which is based on this task, find resources, make referrals. So when this task is marked find resources, make referrals, assuming there are in fact recorded resource referrals, you will get paid for this step. So again, C2C data is pulled, the number of cases with this outcome are counted, and that equals the support and connection dollars provided to your organization. So your organization is not paid for cases that do not have recorded resource referrals. So for example, again, if a case is lost to contact before you make referrals, or you choose not to record resource referrals, then no support and connection dollars are earned. The payment is based on the task being completed, not per referral made. So you will only receive these dollars one time. It's not multiplied by the number of referrals you make. And last is discharge, which is captured by discharging a client, or AKA closing a case, which is based on the task complete discharge form. So when this task is marked start discharge form, assuming there is in fact a discharge assessment on file, it will trigger payment for the case. The C2C data is pulled for the reporting period. The number of cases with this outcome are counted, and that equals the discharge dollars provided to your organization. You're not paid for cases that do not have a discharge assessment. So if a case is closed and you don't document a discharge assessment, you won't be paid for that step of that case. Cases don't have to be officially closed in order to be paid. So for example, the task after this is pending supervisor review before a case is formally closed. They don't have to be, that doesn't have to happen before we can pay for this step in the workflow. Okay, case management payments will be paid every other month. So on the left-hand side of this table is the reporting period, and the right-hand side is when payment will be made. So the first case management payment your organization will receive is in March, and that is for the January and February reporting period. So in early March, OCH will pull the C2C data for your organization, count up how many dollars are earned per stage, and make that payment to your organization in March. And we will be providing reporting to your organization so that you understand what you were paid for, broken down by each stage. Okay, and last is performance incentive. So there's no invoicing or documentation, again, required for these funds, and this is for progress towards 5 metrics. 4 of those are based on your organization's performance, and 1 is based on county-wide performance. These dollars are paid quarterly, and the payment comes upon achievement. Each organization has an up to amount, and you can reference your organization's scope of work to understand what that amount is. And that's based on whether or not you're community or clinical, and small, medium, or large. Okay, so these are the 5 metrics we will be looking at. Participation in OCH-led learning and convenings. The target for the performance incentive, and again, these are intended to reward and incentivize high performance. So organizations that attend more than 4 OCH-led learning and convenings or serve as a partner speaker at an OCH event will receive 10% of your organization's performance bonus amount. And again, these are paid upon achievement. So as soon as you hit more than 4 or you serve as a partner speaker, the next performance incentive payments will include this 10% of your up to bonus amount. Examples of OCH-led learning and convenings include the Hope Awareness training, motivational interviewing training, trauma-informed care trainings we brought in this last year, our regional convening. If you served as a partner speaker at an OCH event, so for example, Chief Black was on a panel discussion at the regional convening, that would meet this target for performance incentive. This is intended to be an easy win for your organization to start to socialize the concept of finding success in a performance incentive model, because that is where sustainable funding is moving towards across the nation. Next is Voices of Olympic Connect. The target for the performance incentive is to provide more than 4 Olympic Connect stories, or to directly connect an Olympic Connect client to OCH for storytelling purposes. Again, paid upon achievement. So as soon as your organization provides more than 4 or connects us with a client for storytelling purposes, the next round of performance incentive dollars will include the 20%. Directly connecting us with an Olympic Connect client, for example, from time to time, for different projects, we might want to connect with clients. There was an example where we asked the Pearson Kitsap YMCA recently if they had any clients who would be interested in participating in a very short interview. And that's an example of something that would count towards this high performance. The last 3 metrics are actual metrics that you have seen in those data dashboard reports. So time from referral to first outreach attempt within 7 days. If your organization's quarterly average is 90% or higher, then you'll receive 30% of that up to bonus amount. And these are paid quarterly, and it is possible to earn in one quarter and not in the next. So each quarter is counted as discrete. So you might hit a target average of 91% in quarter 1, where you would earn this, and maybe you're at 85% in quarter 2 and you wouldn't earn it for quarter 2. Cases with complete documentation at discharge, the organization's quarterly average of 90% or higher will allow you to tap into 40% of that up to amount, and same as the measure before, that it's discrete quarter to quarter. And last is that county-wide pooled average metric. So we're looking at the conversion of referrals to enrollments. If the county-wide pooled average is 80% or higher, meaning 80% of referrals result in enrollments in Olympic Connect, then every partner serving that county will earn an extra $1,000. Again, that's taken quarter to quarter. And I'm going to go into each of these a little more in depth next. So learning and convening first. Remember, there's 5. I'm going to talk about each one on its own slide. Learning and convening. Again, the purpose is to incentivize collaboration, networking, and shared learning across this network of partners. It's eligible for 10% of that up to amount. It's paid upon achievement. It's based on organization attendance, not individual, and both in-person and virtual events are eligible. OCH tracks attendance. You don't need to provide us with anything. And here's some examples of OCH-led events: advisory group, community conversations, regional convening, partner-led trainings, different trainings OCH brings in. The only exclusions that come to my mind today are Olympic Connect onboarding, which is required as a part of using our technology, so therefore is not eligible, and any non-OCH-led events. Voices of Olympic Connect. The purpose is to uplift success stories, capture qualitative data in addition to the quantitative, and to tell the story of this work. This is for 20% of that up to amount, again, paid upon achievement. It's based on your organization's submissions, not individual CBW. Again, OCH tracks submissions, so you don't need to provide us anything in addition to the stories. You do need to use the Voices of Olympic Connect template. We've already shared that with each of your organizations, and we'll continue to uplift that throughout next year. You could also directly connect us with a client, and we might send requests to do this from time to time. And examples of stories include client successes, CBW successes, organizational successes, and that could be your organization or a partner that you work with in the community. The next metric, time from referral to first outreach attempt. The purpose of this is to ensure that clients get connected to services timely and don't fall through the cracks. This is for 30% of the up to amount, and the target quarterly average is 90%. Again, organization-wide, not individual-based. It's measured and paid quarterly, and each quarter is independently measured. A referral is the date a case is opened in C2C. Cases are assigned to your organization by OCH the same day they are opened. And if you are creating your own cases in C2C, it is the date you create the case and enroll them in your organization's channel. And then the date of the first outreach attempt is the date the task, outreach program introduction, and consent for services is marked complete, regardless of the outcome. So we had one of the case management steps on engagement looked at this same task only at the outcome contacted, enrolled in program, because it was looking at enrollment. This measure is any of the outcomes. So it could be they were contacted and enrolled in program, or it could be that you contacted them and they declined, or you could not contact them and you left a voicemail. Next is cases with complete documentation at discharge. The purpose of this is to improve documentation quality and quantity so we can better report to funders and tell the story. This is for 40% of the up to amount. Again, a quarterly average of 90% and above, and that's organization-wide, not individual-based. It's measured and paid quarterly. And this is only looking at cases that have been closed for the reason graduated, successfully completed program. Because obviously, if someone is lost to contact or you close a case for another reason, you may not have had time to capture all of the documentation. So we're only looking at cases that are closed for the reason that they graduated, successfully completed the program. And again, each quarter is measured independently. This is what we are looking at when we look at cases with complete documentation at discharge. So these are the C2C profile fields. First name, last name, date of birth, language, address. We need the type, county, and state. Income, insurer, race and ethnicity, veteran status, employment status, and housing. So when a case is closed for the purpose of graduated, successfully completed program, OCH will run a report to ensure that all of these fields are complete. And if all of these fields are in fact complete, if you hit that threshold of 90%, then you will receive payment within that quarter. And last, looking at conversion of referrals to enrollments. The purpose of this is to improve enrollment and ensure creative strategies are deployed to connect with clients and enroll them in services. It's up to it's $1,000 per partner per county per quarter. It's a lot of purse. So if you serve only Jefferson County, you could earn $4,000 in 2026 for this measure if Jefferson County hits that high performance of 80% and above. If you serve both Clallam and Jefferson counties, then you could earn $8,000 next year. The countywide data on this is shared in our regional data dashboards, and on your individual data dashboard, we will include your organization's performance, and that won't be shared with others, but should inform your internal understanding and conversations about how you're contributing to this shared measure. Okay, I want to pause here for some reflection and to hear from one another. So we're going to do the same thing we did before. So I'm going to ask you to open up that shared document again. You're going to find the third table, which is labeled Activity 2 Funding Model. You're going to find your organization and you're going to put your reflections in the table. So I'm asking you to reflect on one thing the funding model makes possible and one question you still have. And I'm intentionally limiting you to one because I want to hear what's most important or most on top of your mind. So I'm going to organize your breakout rooms again. I'd like you to hold some silence while I do that for individual reflection, and then you'll have about 5 minutes in groups of 4 for small group discussion, and we'll come back as a large group to hear from everyone. And I'm reposting the link in the chat if you lost it. Okay, so again, you should have found Activity 2 funding model. You're looking for your organization and reflecting on the prompts here. I'm going to send you to breakout rooms and I'll see you in about 5 minutes. Okay, and it looks like Anne, Macy, Lori, Desiree, Tammy, are you having a hard time finding your breakout group or are you taking a pass?
Actually, I've been typing my questions. I'll go ahead and join now.
Okay, yeah, go ahead and join your group. Hi, Haiti. Everyone's in a breakout room for another minute and a half, so I'm just gonna keep you here with me.
Okay, we have a power outage in Forks, so it kicked me out.
I'm sorry, Haiti.
Yeah, so I'm gonna try my best on my phone, but
Okay, and if you need to turn your camera off to preserve your bandwidth, please do so, whatever you need.
okay, I will. I will do that.
Welcome back. Everyone's going to start trickling back in from the breakout space. And again, a reminder, you might have unmuted, so if you can mute as you come back in. Okay. Welcome back, everyone. Reminder to mute yourself if you got unmuted. Please continue to use this document to type your questions. I see we have 15 minutes left, so I'm going to pivot and I'm going to read aloud some of the things and themes I'm seeing. And I want to get to our last couple of slides because I know it answers some, but not all of the questions that I'm seeing show up in the document. And like I said, this was just step one. We're going to send you a follow-up with the recording with this document. And I'm guessing what I'm seeing here is we're going to create an FAQ of sorts to answer any questions we weren't able to get to today or to get into a greater level of detail that I'm seeing you are asking for. Okay, so I'm going to start at the bottom here. I'm seeing some themes around questions about minimum caseload expectations and how that's captured and how to know if you're on the right track. So that's something we can definitely follow up with. You can see in C2C at any point in time your currently open cases. You'll also see in your data dashboards that will be provided to you every other month regularly through next year as well. And I also want to re-emphasize when it comes to contract compliance, and I'll get here in a moment, that OCH is really committed to making this work and to continuing to support you all. So I hope there's some mutual trust and understanding that if you are not meeting expectations or if your organization needs a little more time or help or support, that will continue to be a conversation and a collaborative process with one another. I'm seeing some nitty-gritty questions coming in. That doesn't surprise me about like what is the process for filling out that story template? What exactly do I need to put into C2C to make sure that insurance is captured so I can follow up and provide some more detail with screenshots so that it's really easy to follow for your team on some of those more nitty-gritty questions. I'm also seeing some themes around documentation in general and how it's captured. So I will follow up with some more of those pieces and parts. As I look at something that this makes possible, I'm seeing that people are excited about the opportunity to involve more staff, to make this more embedded internally within your own systems, that it offers you all some more flexibility, that it reduces the burden in reporting, the administrative burden of tracking time and collecting backup documentation. I'm seeing that it It provides some more specifications for expectations that felt like they were missing this year, and we'll follow up with even more detail on that. Yeah, so those are the things that I'm seeing as I look at this. And I'm going to turn to the last couple of slides. Again, anything I didn't cover in your outstanding questions is not lost. And I want to make sure we answer some of those in our remaining slides and then follow up with what we're not able to get to in our last 10 minutes. So I saw a lot of questions about contract compliance. So again, OCH really works hard to facilitate your success, and we will make every reasonable effort to support your success in 2026. We recognize that we're all learning together. OCH does not presume to be the expert in this space. We're also learning and have contracted with some national experts to support getting our hub more sophisticated as we work towards sustainability. So we fully expect we're going to have lessons learned as we get deeper into this, and we'll adjust as we need to. The contract does outline the minimum standards for contract compliance, and those minimum standards will be measured quarterly. So if your organization is not meeting those minimum standards within that quarter, we will collaboratively talk about that and create a plan to support your team's success. So for example, if you are a small partner and in quarter one, we look at this and your team is carrying a caseload of 30 instead of 40, that'll be something that we sit down and talk about. We won't make any drastic changes or any drastic decisions. We'll definitely always start with conversation to see what are the barriers to better understand the realities of the day-to-day with your organization and to work together to find some solutions. These are those minimum standards for contract compliance if you were curious and wanted to see them pulled out. That minimum point in time caseload expectation, and again, that's based on the quarterly average for your organization, will continue to meet monthly. And you've likely seen our team has been saying we're going to hold off on scheduling those meetings just a little bit longer because we're thinking through an improved way to do this to honor both our capacity and your capacity and ways we can bring you all together more regularly. We know that we have some surveys we need to complete for funder requirements. This last year there were 2, so we can expect that there will be at least 2, and I do not have timelines for those just yet because we're waiting on our funders, but we'll definitely proactively communicate and commit to giving you as much turnaround time as possible. Typically, the turnaround time for any surveys is about a month. We would like to visit you in person at least once throughout next year at your location. This just helps our team better understand the reality of working day to day. And I know this happened with all of your teams in 2025. And we can definitely visit with you in person more than once because we love the opportunity to do that. You'll attend 4 OCH-led learning and convenings. And remember, more than 4 triggers a performance incentive. Again, you'll provide 4 Olympic Connect stories. And again, more than 4 triggers that performance incentive. The time from referral to first outreach attempt within 7 days, the minimum standard is a quarterly average for your organization of 75% and above. And if you hit that high performance of 90% and above, it opens up that bonus amount. And cases with complete documentation at discharge, again, the quarterly average being 75% and above. And again, only looking at cases that are closed for the reason of graduated, successfully completed program. And that high performance threshold is 90% and above. So again, as always, we'll have proactive conversations with your team about these items, and we'll work together to form plans to support your team in meeting these standards. This is the 2026 payment schedule. So there will be a total of 7 payments under this contract, and this outlines the date, the month the payment comes, and the elements included with that payment. So in January, you'll get that first upfront amount of the infrastructure payments, and in March, you'll get the first case management payment, which is looking at January and February data. In May, you'll get the first performance incentives, and that'll be for quarter 1. And you can follow this through the year. OCH is going to continue to offer regular C2C onboarding. This is required for all new C2C users and those with a lapse in access of more than 6 months. So if somebody leaves your organization and comes back 7 months later, they will need to repeat our onboarding. We will continue to host these monthly at the OCH office from February through November. So no training in January. We'll pick back up again in February. This includes some pre-training work, 1 day of in-person training, and some post-training work. All of those training components, the pre, the day of, and the post, are required before C2C access can be given, and you can start documenting in the system. So we'll send an email in January with registration links and information, and I know some of you have already been reaching out and you have teammates in mind for February's training. So I'll ask you to just hold the date for now and we'll get that process started in a few weeks after holidays. So the date for our February training is February 10th, and we'll send something out in early January with information to register folks for that. I wanted to share with you all before we close some upcoming trainings and resources that are available to you. On January 12th, Molly Barnes, which is one of our trusted helpers at North Olympic Healthcare Network, has offered a youth mental health first aid training. To register for this, you'll just email Molly directly. The training is from 8:30 a.m. to 1 p.m. It'll be held in Port Angeles. It's open to all Olympic Connect supervisors and trusted helpers. And I saw some concerns and questions about how to support folks with mental health needs. And so this might be a nice training opportunity at the beginning of the year. We're also really excited to share with you that we have a Hope training scheduled with Chan Hellman, who is the author of Hope Rising and is kind of the father figure of the Hope Science movement. He is coming in person in January to do some work with Peninsula College, and Olympic Connect care coordinators and supervisors have been especially invited for a training session with Chan. This will be held from 3 to 4:30 at Peninsula College in Port Angeles on January 26th. A really cool opportunity, and we're going to send registration information out to you in the follow-up. And then the last event we have planned for January is the January 28th Advisory Group. This is hosted from 9:30 to 12. It'll be at Red Cedar Hall in Blinn, and lots more opportunities coming. If you wanted to get a jump start and attend all 3 of these, you would have 3 of your 4 learning and convenings complete for the year. Okay, so last, I'd like to invite you to find the chat one more time. And please don't type anything just yet, but find the chat. And I'd like you to type 1 word to share how you're feeling as we get ready to embark on another year in partnership under Olympic Connect. So what you're going to do here is you're going to type it, but don't hit enter or send. So think about your word. When you're ready, type your word, but don't hit enter or send just yet. I'm going to ask us to all hit enter and send at the same time, and it creates this really lovely cascading waterfall of what's on people's minds. Okay, go ahead and hit enter if you're ready. That's either super fun or dizzying. I saw a couple hopefuls, encouraged, curious. Excited, ambitious, lots of hopefuls. Focused, a couple of excited, stretched. I like that. I think it's honest. Contemplative, community, optimistic, helper. Thanks for sharing. Okay, I want to commit to ending us on time. So I'm going to stop sharing my screen, and in our last 2 minutes, I'm going to recap our next steps. Your current contracts end December 31st. New contracts start January 1st. Most of you have your contract for next year fully executed. If you have questions about the status of your contract, talk to your leadership. Sometime this week, I'm not quite sure of the date yet because it might take us a day or two to get organized. I will send a comprehensive follow-up to each of your teams that will include the recording of today's session if you want to share it or revisit it, a frequently asked questions document that will address the questions we see still lingering after today, and will include any additional resources that we mentioned today, like registration links and things to uplift. Of course, if you have additional questions or still have concerns and you think you need to connect with us individually, please reach out to connect at our shared email inbox, as that goes to our full team, and we can make sure that the right teammate gets in touch with you to get your questions answered. I will ask to preserve capacity going into holidays. If you could connect as a team and send us your team's questions in one email, that would be great. So we're getting a maximum of 12 and not 54 emails to attend to that might repeat across your teams. With that, I'm going to end us and say thank you so much for sharing the time this morning. Really, really looking forward to another year of partnership and working together, and wishing you and your families and loved ones the happiest holidays as we close out this year. Thanks, everyone.